Today, we dive into an engaging quiz on antianginals, featuring 10 multiple-choice, scenario-based questions designed to test and deepen your understanding of drugs used in angina. Each question includes 5 options, with detailed explanations provided for the correct answer and why the other options are incorrect. Be sure to check out the companion video linked in the description for an overview of the key concepts related to antianginals. Now, let's get started. Question 1. Mr. Anderson, a 62-year-old man, presents to the clinic with complaints of exertional chest pain relieved by rest and nitroglycerin. His medical history includes hypertension and type 2 diabetes mellitus. His current medications include metformin and amlodipine. Laboratory results are unremarkable. The physician prescribes a long-acting nitrate for angina prophylaxis. What is the most important advice to give Mr. Anderson regarding long-term nitrate use? Option A, take the medication with food to improve absorption. Option B, ensure a nitrate-free interval each day to avoid tolerance. Option C, avoid combining the nitrate with beta blockers. Option D, monitor for bradycardia during therapy. Option E, take the medication at the same time each day. The correct answer is option B, ensure a nitrate-free interval each day to avoid tolerance. The explanation is as follows: long-term nitrate use can lead to tolerance if the body is continuously exposed to the drug without a break. A nitrate-free interval, usually during the night, allows the body to maintain sensitivity to the medication, ensuring its continued effectiveness. Here is the explanation for incorrect options. Option A, this is incorrect because nitrates are well absorbed regardless of food intake. Option C, this is incorrect because beta blockers can be safely combined with nitrates for angina management. Option D, this is incorrect because nitrates typically do not cause bradycardia. Option E, this is incorrect because taking nitrates at the same time daily without a nitrate-free interval can lead to tolerance. Question 2. A 58-year-old man named Johnson presents with chest pain radiating to his left arm. His medical history includes hypertension, type 2 diabetes mellitus, and hyperlipidemia. Current medications include metformin, lisinopril, and atorvastatin. His ECG shows ST segment depression, and troponin levels are elevated. He is diagnosed with unstable angina. Which of the following is the most important drug to administer acutely to prevent thrombus formation? Option A, aspirin. Option B, nitroglycerin. Option C, clopidogrel. Option D, enoxaparin. Option E, beta blocker. The correct answer is option A, aspirin. The explanation is as follows: aspirin irreversibly inhibits cyclooxygenase 1, COX-1, in platelets, thereby reducing thromboxane A2 production and platelet aggregation. This effect is critical in preventing thrombus formation in patients with acute coronary syndromes such as unstable angina. Here is the explanation for incorrect options. Option B, this is incorrect because nitroglycerin relieves chest pain but does not prevent thrombus formation. Option C, this is incorrect because clopidogrel complements aspirin but is not the first-line acute therapy. Option D, this is incorrect because enoxaparin is an anticoagulant, not a primary antiplatelet drug. Option E, this is incorrect because beta blockers reduce myocardial oxygen demand but do not directly prevent thrombus formation. Question 3. A 45-year-old man named Taylor presents with worsening angina symptoms despite being on a combination of metoprolol and isosorbide dinitrate. His medical history includes coronary artery disease and asthma. His physician adds a third drug to his regimen, which significantly reduces his heart rate. Which of the following drugs was most likely added? Option A, verapamil. Option B, ranolazine. Option C, ivabradine. Option D, amlodipine. Option E, clopidogrel. The correct answer is option C, ivabradine. The explanation is as follows. Ivabradine selectively inhibits the funny, if, current in the sinoatrial node, reducing heart rate without affecting myocardial contractility or blood pressure. This mechanism makes it an effective addition for patients with refractory angina who need heart rate reduction. Here is the explanation for incorrect options. Option A, this is incorrect because verapamil is contraindicated in asthma due to its bronchoconstrictive potential. Option B, this is incorrect because ranolazine works by reducing late sodium current but does not significantly lower heart rate. Option D, this is incorrect because amlodipine primarily reduces vascular resistance, not heart rate. Option E, this is incorrect because clopidogrel prevents platelet aggregation but does not address heart rate. Question 4. Mrs. Jackson, a 48-year-old woman with newly diagnosed angina, is prescribed sublingual nitroglycerin for acute attacks. Which of the following is most important to counsel her on? Option A, swallow the tablet immediately after placing it under the tongue. Option B, keep the tablet in a tightly closed, dark container. Option C, take the tablet daily as a preventive measure. Option D, avoid using the tablet during exertion. Option E, expect effects to last for at least 6 hours. The correct answer is option B, keep the tablet in a tightly closed, dark container. The explanation is as follows. Sublingual nitroglycerin is highly unstable and can degrade when exposed to heat, light, or moisture. Proper storage ensures the drug remains effective for acute relief of angina symptoms. Here is the explanation for incorrect options. Option A, this is incorrect because swallowing the tablet bypasses sublingual absorption, delaying its action. Option C, this is incorrect because sublingual nitroglycerin is for acute use, not daily prevention. Option D, this is incorrect because nitroglycerin should be used as needed, including during exertion if symptoms arise. Option E, this is incorrect because the effects of sublingual nitroglycerin last only about 30 minutes to 1 hour. Question 5. Mrs. Harris, a 60-year-old woman with a history of hypertension and angina, is prescribed verapamil. Which of the following is not a likely side effect of this drug? Option A, constipation. Option B, bradycardia. Option C, peripheral edema. Option D, reflex tachycardia. Option E, hypotension. The correct answer is option D, reflex tachycardia. The explanation is as follows. Verapamil is a calcium channel blocker that primarily reduces heart rate and myocardial contractility. Unlike dihydropyridine calcium channel blockers, it does not cause significant vasodilation, making reflex tachycardia unlikely. Here is the explanation for incorrect options. Option A, this is incorrect because constipation is a common side effect of verapamil. Option B, this is incorrect because verapamil can cause bradycardia due to its effect on the sinoatrial and atrioventricular nodes. Option C, this is incorrect because peripheral edema is a possible side effect of calcium channel blockers, including verapamil. Option E, this is incorrect because hypotension can occur due to verapamil's vasodilatory effects. Question 6. A 36-year-old pregnant woman named Smith presents with new-onset angina. Which of the following drugs is safest for managing her angina during pregnancy? Option A, beta blocker. Option B, nitroglycerin. Option C, verapamil. Option D, ranolazine. Option E, aspirin. The correct answer is option B, nitroglycerin. The explanation is as follows. Nitroglycerin is considered safe for use in pregnancy as it effectively relieves angina by dilating coronary arteries and reducing myocardial oxygen demand. Its safety profile and efficacy in pregnant women make it the preferred choice among the options provided. Here is the explanation for incorrect options. Option A, beta blockers can cause fetal bradycardia and growth restriction, making them less safe in pregnancy. Option C, verapamil, though effective, can lead to maternal hypotension and fetal distress in some cases.
Option D, ranolazine lacks sufficient safety data for use in pregnancy and is generally avoided.
Option E, aspirin carries risks of premature ductus arteriosus closure and bleeding complications in later stages of pregnancy.
Question 7.
A 65-year-old man named Clark presents with angina and is started on ranolazine.
Which of the following is not a pharmacological property of ranolazine? Option A, it inhibits late sodium currents.
Option B, it reduces myocardial oxygen demand. Option C, it significantly affects heart rate.
Option D, it improves exercise tolerance.
Option E, it is metabolized by the liver.
The correct answer is option C.
It significantly affects heart rate. The explanation is as follows: ranolazine primarily works by inhibiting late sodium currents and reducing myocardial oxygen consumption without significantly affecting heart rate. This makes it suitable for patients where changes in heart rate must be minimized.
Here is the explanation for incorrect options.
Option A, ranolazine's primary action is to inhibit late sodium currents in myocardial cells.
Option B, it reduces myocardial oxygen demand by improving metabolic efficiency.
Option D, ranolazine improves exercise tolerance by stabilizing myocardial energy consumption. Option E, ranolazine is metabolized by the liver, a key pharmacokinetic property.
Question 8.
Mr. Carter, a 70-year-old male with a history of chronic stable angina, is started on ranolazine.
He asks about the mechanism of action of this drug.
Which statement best describes the pharmacological action of ranolazine? Option A, reduces myocardial oxygen demand by dilating coronary arteries.
Option B, blocks late-phase sodium channels in myocardial cells.
Option C, enhances myocardial oxygen delivery by reducing preload.
Option D, increases myocardial contractility by stimulating beta-adrenergic receptors. Option E, blocks calcium influx into smooth muscle cells.
The correct answer is option B, blocks late-phase sodium channels in myocardial cells. The explanation is as follows: ranolazine inhibits late-phase sodium channels in myocardial cells, reducing intracellular calcium overload and improving diastolic relaxation. This mechanism alleviates angina without major effects on blood pressure or heart rate.
Here is the explanation for incorrect options.
Option A, ranolazine does not primarily dilate coronary arteries.
Option C, preload reduction is not the primary mechanism of ranolazine. Option D, ranolazine does not stimulate beta-adrenergic receptors or enhance contractility. Option E, blocking calcium influx is a mechanism associated with calcium channel blockers, not ranolazine. Question 9. Ms. Davis, a 45-year-old woman, is prescribed a beta blocker for the management of her angina.
She has a history of asthma, which is well controlled with an inhaled corticosteroid. All of the following statements about beta blockers are correct except Option A, beta blockers reduce myocardial oxygen demand. Option B, they are contraindicated in asthma due to bronchospasm risk. Option C, they improve survival in patients with prior myocardial infarction.
Option D, beta blockers can mask symptoms of hypoglycemia.
Option E, they may cause fatigue as a side effect.
The correct answer is option B.
They are contraindicated in asthma due to bronchospasm risk.
The explanation is as follows: cardioselective beta blockers, such as atenolol, are not absolutely contraindicated in asthma. With careful monitoring, these agents can be used safely in asthma patients, unlike non-selective beta blockers, which carry a higher bronchospasm risk. Here is the explanation for incorrect options.
Option A, beta blockers reduce oxygen demand by slowing heart rate and contractility.
Option C, they improve survival post-myocardial infarction by reducing cardiac workload. Option D, beta blockers can mask hypoglycemia symptoms by blunting adrenergic responses.
Option E, fatigue is a common side effect due to reduced cardiac output.
Question 10.
Mr. Garcia, a 50-year-old man with a history of angina, reports worsening symptoms despite taking sublingual nitroglycerin as needed.
Upon further evaluation, the physician suspects nitrate tolerance. All of the following measures are recommended to prevent nitrate tolerance except Option A, incorporating a nitrate-free interval. Option B, using the lowest effective dose. Option C, combining with a calcium channel blocker. Option D, using sustained-release formulations continuously.
Option E, alternating nitrate therapy with other drug classes.
The correct answer is option D. Using sustained-release formulations continuously.
The explanation is as follows. Continuous use of sustained-release nitrate formulations prevents the restoration of nitrate sensitivity, leading to tolerance.
A nitrate-free interval is essential to maintain effectiveness. Here is the explanation for incorrect options.
Option A, a nitrate-free interval helps restore sensitivity and prevents tolerance. Option B, the lowest effective dose minimizes the risk of tolerance. Option C, calcium channel blockers can be used adjunctively to enhance angina management. Option E, alternating nitrate therapy with other classes reduces tolerance development.
Conclusion. That wraps up our revision on antianginals.
I hope you found this quiz session engaging and informative. To deepen your knowledge further, consider reading resources like Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF. These references will solidify your understanding and enhance your preparation. Also take note that in this video, any mention of guidelines will specifically refer to those outlined in the BNF.
Thanks for watching.
If you found this video helpful, don't forget to give it a thumbs up and share it with others.
Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.